Every early learning program that remains open during this time should have a plan in place to protect their staff, children, and families from the spread of the coronavirus, COVID-19. The Center for Disease Control and Prevention, CDC, have developed a few recommendations on the cleaning and disinfecting of common areas and surfaces. The Jumpstart ECC team wants to support you in following these guidelines to make sure you are safe at all times. The first recommendation is to update your children's drop-off and pickup procedure. Consider taking your staff and children's temperature before they walk into your school. If they have a temperature of a 100.4 or higher, encourage them to go back home as a precaution. If it is safe, consider greeting children and placing your sign-in station outside or immediately close to your school entrance. Coordinate and set a time limit around children's drop-off and pickup to limit direct contact and the formation of large groups of caregivers. The second recommendation is to update your staff's maintenance protocol. Set up a hand hygiene station at the entrance of your school for your staff and caregivers. Encourage your staff to frequently wash their hands, but keep the cleaning products out of the reach of children. Clean and sanitize and disinfect surfaces and objects like toys that are frequently touched every 15 minutes using soap and water or products with a high alcohol content. Encourage your staff to always cover their mouth and nose with a tissue or the inside of their elbow when they cough or sneeze, and to immediately wash their hands. Covering your mouth and nose with a cloth when around others is recommended to avoid the spread of the virus by silent carriers that do not show symptoms. However, children under age 2 should not be using face masks or clothes to avoid suffocation. Remember, the face covers do not substitute frequent cleaning or social distancing. Encourage and facilitate social distancing in your school. Pick the hand washing song of your choice and make frequent hand washing part of the children's daily routine. This is the moment to remind children of the importance of keeping their hands to themselves and to use no-touch greetings such as air high fives, elbow bumps, waves, kisses, and verbal hellos. Bye-bye. Rearrange the children in common areas to create distance. Some facilities are more spacious than others, but get creative about separating play areas in classrooms to avoid large groups. Have children face the same direction rather than each other when sitting at a table, and leave an empty chair in between each child. Use visual aids like tape or stickers to illustrate appropriate social distance, making it a fun activity. Consider coordinating the use of the playground to avoid large groups of people with multiple classrooms. The fourth recommendation is to talk to children about the coronavirus in an age-appropriate way. Let children lead the conversation about the topic. It's important for them to feel safe to talk to you about what they're feeling or thinking. Use age-appropriate stories and videos that explain the virus in non-scary ways. We know that everyone's routines have changed, but keep children busy. Refer to the COVID-19 Resiliency and Support Toolkit in the Jumpstart ECC website for inspiration on child activities to do during this time. The fifth recommendation is to manage your stress. Stress and worry are normal during this time, especially when you are responsible for taking care of others. But don't forget to take care of yourself. Remember to eat healthy, stay hydrated, incorporate some sort of physical activity in your daily routine like a walk in nature. Take advantage to get plenty of sleep and take naps. Feeling scared or nervous is normal, but try to stay calm to reassure your children that everything is going to be okay. Take deep breaths, stretch, give yourself a moment to meditate or stay still or do something you enjoy. Help your children do the same thing. If you get anxious, like Tucker Turtle, you can tuck inside your shell and take 3 deep breaths to help you calm down. If you think you've been exposed to COVID-19 or have developed symptoms such as fever, coughing, and/or difficulty breathing, call your doctor or county health department for advice. Remember, you can recover from the coronavirus.
We are grateful for your services and for supporting the children and families in our community.
Estamos agradecidos por los servicios y apoyo a nuestros niños y familias de nuestra comunidad.
Nuga mestio po serviço e po sipon no baitimun at famina communauté.
If you need any additional information and resources, contact us at jumpstartecc@miami.edu. Childcare providers, please stay in constant contact with your Florida Department of Children and Families Childcare Licensing Counselor for questions and updates. You can also call them at 786-257-5207 or refer to their website for more information.